Okay, we're going to get started here on the Nexus stage with our first presentation. We have AHV, which has been awarded for its StopLac product. And I have with me a special guest today. We're going to invite to the stage Dr. Chris Rock, and he will be presenting on this new product, how it works, and how it could be useful on your own operation. So I'll welcome to the stage Dr. Chris Rock.
Thank you. Thank you. All right, ladies and gentlemen, we lost something already. Hopefully that's all the mistakes that happened during this. So my name is Chris Rock. I'm one of AHV's Tech Service Veterinarians. I'm born and raised in Iowa and graduated from vet school, went and practiced in eastern Iowa for a few years. Then ended up having carpal tunnel on both hands. So the doctor told me, hey, you should probably go find something else to do for the next few years of your life. So in comes AHV. But enough about me. I'm here to talk about StopLac. It is our new released just under a year ago product that is facilitating cows, helping them actually dry off, right? It's one of the first actual products that's going to help dry cows off. And so today, going to briefly talk about, is there a need for this product, why we came up with this product, what it does, how it works, and then looking at some external research as far as some US data. And so as I'm going through this, I would encourage you guys to think about your own dry off day. What are you doing on your dairy the day of dry off? What are you giving? Why are you giving that, right? Think about those things and maybe think about how a new product could be introduced into your own dairy. So at the 65th National Mastitis Council, what's best for her was the theme of the day, right, or the theme of the conference. So again, what is best for her? What's best for that cow at that moment of dry off? And so what their recommendations are, and they've got a lot of reasons for doing this, are abrupt cessation of milking, right? We're looking at that. And then the target yield is about 35 pounds or 15 kilograms of daily yield or less. And then after you dry that cow off, obviously look at, watch the udder. Monitor for the next couple days, make sure she's doing all right. How many of you guys are hitting 35 pounds the moment of dry off? Probably not a whole lot, okay? Right? How would you stay profitable if you were hitting 35 pounds at the moment of dry off? So there's a lot of people out there, this is the other data that was out there, about 85% of cows are not hitting that moment. So what does that mean? What does that mean for that cow, right? You have cows that are getting dried off 30 or 50, 60, 70 pounds of milk or more. What is that doing to her, right? We got these nice big udders. There's got a lot of pressure. We've got a lot of stress on that cow, okay? A lot of leakage, a lot of open teats. Well, if milk can get out, bacteria can get in. So that's what we're looking at. That's what the AHV product is going after. That's what StopLac's going after, okay? So if we take a look at these two cows, the cow on the left was about 75 pounds the moment of dry off. Cow on the right, different cow, obviously about same pounds, about 75 pounds the moment of dry off, okay? This cow on the left was given antibiotics and a teat sealant. Cow on the right was given StopLac. So the StopLac protocol is after the last milking, giving her 4 boluses. So you give her all 4 boluses all at once. They're all the same thing. We give those boluses, and that's what our dry off protocol is for that cow. So if you look, 24 hours later, the cow on the left looks like a pretty typical dry cow udder, right? She's milking 75 pounds. We're shooting for 35, she's milking 75. She's over double that, okay? It's what we normally see. A full udder, it's red, right? We expect to see that. She's probably not uncommon for those cows to be bellowing or pacing that pen, okay? Cow on the right, that's what those StopLac udders look like. There's less milk in there. They're more comfortable, a soft, pliable udder. That's what we're looking for these StopLac cows after the moment of dry off, okay? So what StopLac is doing is drastically reducing the volume of milk the moment of dry off, or within 24 hours after dry off. So we're looking at about a 50 to 60% reduction in milk production the moment of dry off. And so what we did to test this was we gave it to some mid-lactating cows, kept lactating, or kept milking them, and kept them on that lactating diet. And we watched what they did. So 24 hours later, we had that big reduction. And if you keep milking them and keep them on that lactating diet, about 7 days later, they're going to come back into that normal production, okay? So big thing here is it's reversible. We can give this product, it's not permanent. We're not causing permanent damage. There's a lot of ways you can dry cows off. Some of them might just not be as good as others, okay? So that's what we're seeing with StopLac. When we compared that to some competitors that are also in the market, some of these are available here in America. AHV is a Dutch company, so some of these are only available overseas. We looked at it. We did the exact same thing, okay? We kept milking these cows, kept them on that lactating diet, and watched what that milk production did. And you'll notice here, 15 kilograms. This is in kilograms here. Again, we're Dutch, so they like their kilograms. So looking at that, there's only one product here that's getting them under that 15 kilogram threshold, right? That 35-pound threshold, okay? That's the AHV StopLac, right? That is our goal, is to get that cow to dry off as quickly as possible. Get that milk out of the udder as quickly as possible. Let that active involution phase actually happen. Let that keratin plug form. That is that cow's natural sealant, okay? So how does that work? What's going on? So when we're giving these boluses, what we are doing is affecting the ratio of bacteria, rumen microbes. And so we are altering that fermentation. If we can alter that fermentation, shifting from a high level of propionate to more of an acetate or butyrate, right, we can allow for different volatile fatty acids available for production and milk production. Now, I'm no nutritionist, so please don't ask me a boatload of questions here. But 3 main volatile fatty acids, acetate, propionate, butyrate, right? When we're looking at the udder, acetate and butyrate are going towards milk fat content. Those are the 2 that are going for milk fat. The one that's producing volume, that's focused on volume, is propionate. So when we can affect what's going on in the rumen and affecting what volatile fatty acids are available, we're altering that fermentation. We can shut off that propionate production temporarily, and it'll lead to less lactose. And again, I'm going to show you a cross section here of an udder. So we've got this udder here, and then we've got the alveoli lining that udder. So what happens to that propionate that gets produced in the rumen? It's going to get converted in the liver. It's going to get converted into glucose. That glucose likes to end up in this epithelial cells that's lining that udder. So we end up with glucose in there. That glucose gets converted to galactose, binds with another glucose, and forms this big sugar. Essentially, it's too big to leave, right? So now it's too big to leave. It can't leave that epithelial cell. Water likes to make things even. So now we've got this sugar molecule in those epithelial cells. Water wants to flow in to even out that concentration. So now we have water, we have sugar. Guess what? You add a little fat and protein and you've got milk. So if we can shut that off temporarily, we can affect milk volume being produced. So again, if we can shut that propionate production off, looking at affecting how much lactose is available for milk production, we can affect milk volume. Less water flows into that udder, we have less milk being produced. Okay? Looking at some external research. They wanted to know, so we took it to a company called Room Expert overseas, and we wanted to know, is this safe to give? Is it a safe product to give? Are cows going to have any toxic reactions, right? Are these going to be healthy to give? And so what they looked at was they did some testing, they did some blood sampling, they did some udder secretion sampling, and then they just kind of overall monitor of the udder, right? They visually monitored that. And so they looked at these udders the day before dry off, 3 days after dry off, about 40 days after dry off, and then 7 days post-fresh. So we're tracking that cow through that period, right? So they wanted to monitor that. And so this is what they are showing us. So when we're focused, if you look at the left side here, that's a drawing of that udder. So what we're showing here is that we have a decrease in pH of the udder secretions, not the rumen, in the udder secretions. So turns out our immune system works better. Our neutrophils work better at a low pH, okay? The other thing is that there's less lactose there in those secretions. Again, we would expect that if we know we are affecting, if we're altering that rumen fermentation. So we have decreased lactose. The other part about lactose, other than driving milk volume, is that it is a great growth medium for bacteria. It's energy for bacteria. If you can get rid of that, you can have less bacteria growth, okay? So we've got less volume there, less milk there. Again, milk is what is inhibiting, in that udder, it's inhibiting that active involution phase. So if we can get that out of the udder, the faster we can do that, the more involution, or the quicker that active involution stage can happen. And that allows that cow to, again, seal that keratin plug up. They also noticed about 70% were leaking less, or about a 70% reduction in cows leaking. Again, we would expect that if we're cutting milk volume, okay? So that's all about 24, 48 hours after the moment of dry off. Now, when we're looking at the moment of calving, what are we seeing metabolically? Well, about everything was the same, except for a couple of different things. So we had less CK, or CPK overseas they use. It's muscle. It's an enzyme in muscle, suggesting muscle damage. Okay, so we had less muscle damage going on in those cows, as well as decreased NEFAs in the body. NEFAs are precursors for ketosis. So when we give this product and we're having less ketosis, less muscle damage, those cows are more likely to be able to get up and eat and have less chances of ketosis, right? Less ketosis risk after they calve in. So is it a safe product to give? Yes. Yes, it is. But what does it do to the cows production-wise, right? That's all lab type stuff. So we got impatient, so we started testing it. So from here in the next few slides, we've got AHV versus control. Control was antibiotics and teat sealants, internal teat sealants, whereas AHV was the 4 StopLac boluses. That was them, okay? So in purple, we have AHV versus control, about 365 cows in the AHV group, 340 in the control group. And so when we look at dry period health events, what's going on during that dry period? Is it safe to give? Looking at culling, mastitis, and abortions, these are percentages, really no difference, right? We did not have any more mastitis cases, no more culling, no more abortions, okay? Is it safe to give? Well, it sure looks like it. When we're talking leakage, we had less cows leaking. Again, that's something we would expect, knowing what the product does. Looking at fresh cow, 60-day mastitis rates, okay? 1.1 versus 1.5% of cows are getting mastitis. So when we're looking at comparing AHV versus an antibiotic and a teat sealant, are we safe to give? Sure looks like it, okay? When we start looking at somatic cell, so on your left would be the dry cow somatic cell. That's the last testing at dry off, and then this first, second, third, and fourth test. I'm not really looking too much into this. We could have one cow really spiking that, so I'm not saying that AHV is really crushing it there. However, are we a safe product to be given? Are we an alternative to what can be done that is currently accepted in the field? Yeah, it sure looks like it. Okay, that's what somatic cell is doing. So if we looked at mastitis, we've looked at somatic cell. Let's look at production. Okay, what are these cows doing that next lactation production-wise? We're seeing a little bit more milk coming out of these cows, that next production, or that next lactation. Why is that? Well, again, if you can have a better active involution phase, that's that repair phase of that udder. If you get a better repair of that udder, you're more likely to have more milk that next lactation. So quality of milk has been unaffected. The volume of milk has been a touch of an increase there. So let's hope that this works here. Fingers crossed, everybody.
So these are the ones we dried off yesterday. All these 32 cows. And then that's one, the one next door is their tubes. They're all balding. Look at these cows, not balding at all. Tubes next door.
So think about it. What's best for her? What's best for your cows? That's what I have for you guys today.
Thank you. Well, come over here. Thank you, Dr. Rock. We appreciate your presentation. Are there any questions that you have for Dr. Rock? Yes.
Packaging, it's coming in a box, and we've got 40 boluses in a box because it's 4 boluses per cow. And within that box, the 4 boluses are in one kind of plastic case. A touch bigger. They're a touch thicker than our normal AHV boluses. We do have a special applicator for it, yep. Yep. And we have a multi-dose gun. You can fit all 4 boluses into one dosing gun. That way you don't need to go out that cow multiple times, just one time.
Good. Other questions?
Yep. Cost of treatment, retail on StopLac is $38.50. These are multiple different herds across multiple different states.
The next question is, so you're changing the bacterial flora in the rumen, which in most cases makes cows not want to eat.
You are correct.
And I ate sick cows. So what's preventing that from happening when we get these pills?
Yep. So we do not kill bacteria. Our products do not kill bacteria. So we're not. We are affecting the production of that bacteria that's currently there. So we are not altering the actual bacteria that are present. So the microflora that's there is unaffected. How do they go about their job? They use quorum sensing. So they send out signal molecules into the environment. It's their bacteria's way to communicate. That's how they go about forming those volatile fatty acids. We are disrupting that communication. And it's very, very specific to certain types of bacteria in that rumen. So we are not affecting that. Ultimately, what I want to see is rumination, right? Do we have a decrease in rumination versus a control group versus cows that did not receive AHV? No, we do not. We have a dip. Like every cow that you change pens with, you adjust her diet, you are going to see a dip in rumination. So do we see that dip? Yes, we do. Do we see the dip in the control cows that didn't get it? Yes, we do. So we see that same dip, and they come back. So no, we are not ultimately affecting rumination above and beyond what a control group would have.
You can decrease the production of acid.
Yes.
Do you have a bolus that will increase the production?
Not at this time. I wish I did. That's a good idea. That is a good idea.
Could we go the other direction?
I can get you to make more fat with this, right? Out of the secretions, we had quite a bit more fat. Again, if you're affecting the acetate butyrate, so you can have more fat. But I'm not suggesting we give that for more fat content in what little milk's left. But yeah, no, we don't want to do that. So
From an application perspective, when producers go on this product, do you see them using it as a whole herd treatment? Are they doing it over certain lactation groups? How do you see that happening?
yep. So it's been a mix. It's been a mix. Some guys are only going after their high cows. Some guys are doing it for everybody. Kind of depends on the on-farm application. I think the big thing that we are seeing is that we're getting the dry-off period out of the parlor. So a lot of times guys are using that parlor to dry off, where then they're backed up for the rest of the day, and they're playing catch-up. With this product, we don't need to be giving that in the parlor. We can go do it wherever there's headlocks in the dry pen, so that's been kind of freeing that parlor crew up. And a lot of times we can get that done quicker than what we normally could with tubes and sealants. Especially if it's like a rotary where you have to fill it, empty it, and fill it again, then time-wise, it's been a time saver, big time.
Other questions, Dr. Rock?
Yep.
How's it different than Bovacalc dry?
So different modes of action. Bovacalc dry is an acidogenic diet, so it's going to acidify that rumen. And so that's how that's going to work. And if you look at the volume of reduction, how much can we reduce? We've asked, and when we've asked BI about how much they're reducing, it's about 8 to 10 pounds. We're going to be a bit more than that. So, same time. All 4 pills, same time. Milk her for the last time, and then give it to her soon after milking as possible. We can reduce the production of milk. I can't take milk out of the udder. Right, if it's already been in there, if it's already been produced, I can't really do anything about that. So,
Other questions?
Is this organic certified?
it is. It has been OMRI certified. Yep, like a week ago, I think. It was pretty quick. So,
Good question.
So can you give it more than 12 hours prior to previous milking? Dry off, or is there that normal?
why would you? So no, we have not been given that prior to milking, and I don't like this going back in the tank afterwards. It's a potent smell, right? I'll be completely honest with anybody that's ever used it or used AHV products in the past. It's pretty potent smelling, and so I don't like that getting into the tank. It's not illegal, but I'd prefer that not to happen, right? And so, but with the reduction that we're seeing, I don't want to give it and then stimulate that udder again, right? I don't want to retrain that milk let down and go through that again. So, and knowing how it's in and out of the system so quickly, I'm afraid she's going to start kind of rebounding. So I would, last time milking, give the boluses.
Any other questions?
Yeah, was colostrum production monitored on your study?
On this particular one that I showed you, no. So we have monitored colostrum production for both volume of colostrum as well as quality, and those are both unaffected. So we have not seen those affected. And knowing how quickly I can get a cow back into milk if I stimulate her again, I'm not too worried about milk production. Colostrum production. So knowing that we're not causing that permanent damage.
Any other questions? Some good ones. All right, well, Dr. Rock's going to be on the innovation lane here with his booth and his colleagues. So if you have any other questions or want to ask specific questions about your farm and getting involved with AHV, they will be there. Thank you very much.
Thank you, guys.